I have grandsons who are like restless about, wait a minute, why do we have to keep on behaving this way? It's been too many months. But unfortunately, the virus doesn't care that we're tired about this. And you can see the consequences of people relaxing a little too much. It is the case, isn't it, now that a lot of those new cases are younger people, maybe because they have been willing to go to places like bars, which are not a good place to be if you don't want to catch this. Some people are saying, well, we don't have to worry so much because young people don't usually get that sick. But there's a problem with that, isn't there?
Well, there's a big problem with that, Francis. First of all, you're right. The average age of people getting infected now is a decade and a half younger than what it was a few months ago, particularly when New York and New Orleans and Chicago were getting hit very badly. That's the first thing. The second thing that we're trying to get the messaging across, young people should not feel that they're invulnerable to serious consequences. The more we learn about this disease, Francis, the more we realize that many young people may not necessarily get sick enough to go to the hospital, but they can get very sick, put them out of action for weeks at a time. The other thing is they should not think that even if they get infected and they have no symptoms at all, that they are in a vacuum. They're not, because by getting infected, they are propagating the outbreak, because inadvertently or innocently, they could infect someone who'd infect someone, and then all of a sudden someone's grandmother, grandfather, or aunt who's getting chemotherapy for breast cancer gets infected. So although you think you're isolated in a vacuum, you're not. You're part of the propagation of the pandemic. So it's your responsibility to yourself as well as to society to avoid infection. That's a message. I know it's difficult to get out to young people, but they really need to understand that.